2.
So good afternoon and thank you for joining us today. My name is Cathy Ellis and I'm proud to be the chair of Leicestershire Partnership Trust and chair of our charity Raising Health. So welcome to the annual general meeting where we will report on our performance for the year ending March 2021. There is time for a question and answer session at the end of the meeting today and we will be opening the chat once all the presenters have spoken. So moving on to the next slides, please, Kartik, and the next one. So let me start by introducing our trust to you. We provide mental health, learning disability and community health services for the 1 million people who live in Leicester, Leicestershire and Rutland. Our 6,800 staff connect with patients and their families at times when they need us most. Our services are there from birth to end of life. I'd like to take this opportunity to say a huge thank you to all of our staff and our volunteers for their exceptional work this year, particularly during the pandemic. Their compassion, teamwork and dedication to providing great care has shone through in the most difficult of times, so thank you. On our next slide, you will see our vision, values and strategy. So our vision was co-produced with our staff and it's to create high quality, compassionate care and wellbeing for all. We have 4 values: compassion, respect, integrity and trust. And together with our leadership behaviours, they drive our culture, both in the way we deliver our services and the way that we work with our partners. Our strategy is called Step Up to Great. And each of those 9 bricks at the bottom represents one of our priorities that we're working on to drive improvement across LPT. Angela will talk more about our Step Up to Great journey later on in the presentation. So on our next slide, I'm going to talk about patients, and patients are at the heart of everything we do. We start every board meeting with a patient story, and this is usually a video clip giving us feedback on our services. So I've got a short film to show you today. This is Ismail's story, and his parents will talk about their experience of accessing our learning disability services. So we're now going to show you the film.
My name is Hashim Douale, and I'm the father of Ismail Douale.
My name is Samia Ali. I'm the mother of Ismail Douale. Ismail is 20 years old. He's been diagnosed when he was 8 and with autism and learning disability. He's been in a special needs school from age of 4 up to when he was 18 years old. He's been doing great up to 19 years old, and then he had high anxiety due to changes from high school to college, and then we had help from Leicester Partnership Trust. He's been admitted in a unit. They've been involved with him since of age of 13 years old. Now he's living in his own house with the support of support workers, and he's really doing good. He's really doing more than good. He's doing great. And that's Ismail.
During his inpatient experience was very good. They involve us also because we knew our son. We grew him, so regular communication and MDT meetings. We were there to talk about him, and I couldn't thank them enough. And I went even on record writing to the Chief Executive of Leicester Partnership Trust, making my point, because people always complain when things go wrong and never acknowledge when things are good. Now, if you see Ismail, he kind of independent person, yes, with the support of his carers, but he has his routine, even though the COVID made everything difficult, but he's coping because he knows that this is his territory. He knows his chores. He does everything himself. So I I think what has done most is that element of the psychiatrist and the health team find out was that he was really wanting his own space now that he is a grown man. Ismail taught us everything now that we are helping with other parents, and our way is simply trying to bring the services closer to the community.
That's the reason that we started this Dariel, to help other people, other parents like us who are suffering more than us, which is the lack of understanding the services that is out there for them. Ignore the stigma, because the stigma cannot help you. All it can contribute is stress and not accessing what your child needs or wants.
It is important. It's important. We are trying to be fair to bring our community closer to the services as much as we can. And that my son who told me all this, and we're here to help others.
That's a lovely story, isn't it? I'm really proud to see that Ismail is living independently with the support of his carers and his family. It's so important for us to involve our families in the care of their loved ones, because we want to personalise our service for them. And I also want to say a big thank you to Ismail's parents for the work that they're doing locally in the Somali community in Leicester. This is helping other families to access the care that they need. So I'm now going to move on to talk about our charity, Raising Health. The donations we receive through our charity provide money for the extras which are not covered by core NHS funding. This enables us to go above and beyond the core NHS offer to enhance the experience of our patients and the well-being of our staff. We have a Raising Health website which contains details of our current appeals and allows you to give donations online. I want to assure you that all donations are used locally to support improvements to equipment, care settings, patient activities and research. So on this slide, I've got a few photographs which give examples of recent projects. If I start at the top left, you will see the Bradgate Mental Health Unit garden. And here we're using gardening as therapy, where our staff work alongside our patients to create and maintain this lovely garden area. In the centre at the top is the outdoor area at our new Beacon unit, which is for our young people's mental health inpatient services. And here we funded sensory equipment for therapy and also sports equipment to use on the AstroTurf area, which is outside, and you can see it in that picture there. In the top right, local people and local businesses supported us at Christmas, particularly this Christmas, which was difficult for our inpatients. So they gave us gifts to pass around our wards for our patients, which was lovely. And at the bottom, you can see pictures of our staff getting involved in fundraising events. So I'd like to say a huge thank you to our staff who do that, whether it's running, football or other events that they organise. And finally, I would like to thank every family that has left us a legacy or made a donation this year. As you can see, your money is really making a difference to our patients and staff. On my next slide, I just want to talk about staff wellbeing. I'm really proud to be the health and wellbeing guardian for LPT. In this role, I'm championing a healthy workplace and a healthy lifestyle, and I want to ensure that LPT delivers this for all of our staff. In the last 18 months during the COVID-19 pandemic, the NHS received huge support from the public. So thank you so much for all your gifts and donations. We really appreciated it. And Raising Health received significant donations from NHS Charities Together, the national charity, which again we've used locally. These pictures show some of the support that we provided to our staff through our wobble rooms or our lunchtime exercise classes. So in conclusion, my three key messages for you this year are firstly, that we're a trust that wants to hear the voices of our patients and carers to help us make improvements to our services. Secondly, thank you again to our staff and volunteers for stepping up to great this year. And finally, we will continue with our charity fundraising because we want to improve a core offer. So thank you. I'm now going to hand over to Angela Hillery, our Chief Executive.
Thank you, Kathy. Good afternoon, everybody, and hello. My name's Angela Hillery, Chief Executive of LPT, and I'm really proud and privileged to be able to share with you today our year of review. There's so much to share, it's just been difficult to contain it all, but thank you for joining us this afternoon, because it really is a tribute to the staff that you've come along to listen to what they've been doing across the trusts across this year. Next slide, please. This gives you just some sense of what LPT is about, and just to give you some of the numbers that really do make a difference in the organisation. And you'll see there that we have over 100 premises that we are delivering care or maintaining care within. It's a significant number, being a community and mental health trust. We deliver over 1 million community contacts. That's a lot of people, a lot of staff making a difference every single day. And you'll see, as Kathy's already mentioned, we have over 6,500 staff who are really stepping up to great and delivering our strategy and making a difference to our local populations. And I wouldn't want to not mention our volunteers, who are absolutely stepping up every single day, being very active with us and making a difference to patient care at the front line. But I want to really share with you through a film some of that brought to life, because it's very difficult to give you a sense of our year without giving a little bit of sense of that in pictures. So I hope the next period of the film gives you a sense of what it's been like. Thank you. So I'm sure you can see that so much has happened over the year, and of course we couldn't include everything, and we'd want to, but of course you wouldn't be able to spend all the hours that we'd need to do so. And I just want to pay thanks to all of the staff who obviously have participated in that material, but for those that weren't in the material, because there was many other examples, and all that we've illustrated has only been possible because of what our staff and volunteers have done through the year. Next slide, please. This gives you a sense of all of the innovation that we've been doing through the year. It has continued relentlessly through a period of unprecedented challenge in COVID. But to give you just some of the examples of innovation across the Trust, in the left-hand corner, you'll see at the top there, our new urgent care hub for mental health patients. This was absolutely a great example of teamwork in action, where people introduced a really important piece of the jigsaw for our COVID response very quickly indeed, and it has been nationally recognised. We also introduced a 24/7 central access point so that people could get responses quickly in a timely way, and we could make sure that people were getting the support they needed from a signpost to those that needed services from others too. We've also expanded our mental health support in schools. Really pleased, because we know again through COVID and before COVID, mental health in our children and young people really does need additional support, and this population is benefiting from that. Kathy's already mentioned our Beacons unit, but I wouldn't want to move on from our innovation without mentioning our newly formed People's Council, which really is a very strong asset to us here at LPT, where we're building the community to help us challenge and confirm and really take us to the next level of high standards of care. So we want to thank them very much for their contribution to us, and we look forward to working with them in the future as well. Next slide. So yes, I've talked about our staff. Here's some illustration of it. They have been phenomenal, and I cannot say enough thanks. I really hope they know that. I hope that you can hear what I'm saying, because they have been absolutely tremendous. And whether it's been adapting new ways of working, developing new materials, making sure that vaccinations can happen, being redeployed in some occasions to services that they weren't as familiar with, it's been truly tremendous. And our volunteers have continued to play a very active role, making sure that we can get medications out to our populations too. I could go on, but you get the message. Our staff, our volunteers are incredible, and we're very proud of them. Next slide, please. So I'm really encouraged to share with you that not only have we had the support locally, but nationally we've had a lot of recognition too through the year, and that's given us quite a lot of awards. So we've had awards for our partnership working, we've had awards in terms of being shortlisted for our workforce race equality work and our real commitment to diversity and inclusion. And we've had a lot of focus on our digital solutions too. And many of these demonstrate the fact that our staff are going above and beyond and really pioneering work for the NHS and the care sector as a whole. And I really do welcome the awards being received, because the staff get so motivated by it being recognised by others, and also being able to share best practice with others too as a learning organisation. Next slide, please. Now, Kathy's mentioned our Step Up to Great strategy, and of course this has been a really essential feature of the year, because we've used it to focus on the improvements that we've needed to make. And you'll see through all of the bricks improvements, and we've had a journey, as you would expect, through the year to focus on the component parts. We've moved from developing the strategy and vision right through to focusing on our governance, which we knew we needed to improve upon from our CQC inspection report previously, to transformation, quality improvement, and our cultural work with our staff, because we recognise that staff experience really directly affects patient care. So really pleased to share with you that our journey is continuous in our recovery work, but absolutely has been fundamentally linked to our Step Up to Great strategy. And of course, our staff very much recognise this as well in terms of the services that they're delivering. Next slide, please. Now, this gives you a really, hopefully, a good illustration of some of the photos of staff celebrating, because one of the areas of focus that we've had is about our quality accreditations. This is where we do internal processes to peer review and look at how we can improve our standards of care and recognise the standards internally to improve them. And these are some good examples of staff receiving their accreditation certificates. And then you can see from the smiles, people feel very pleased to be getting those because they want to improve the care, they want to improve the standards, and the accreditation process really does help us with that. Next slide, please. Now, our estate, I've mentioned the number of buildings, and of course, estate is a constant focus for us here at LPT. And I'm pleased to say that we've improved a lot of our estate. And Richard Wheeler is here, but he will be able to share with you some of the elements that we've been focusing on recently to make a difference, because we know patient care is affected by our estate. And here are some of the examples of our refurbishment in our mental health areas. And Kathy's of course mentioned our new building in relation to our CAM services already. But we know we've got more to do. We know that we have dormitory accommodation in our mental health setting. We want to improve that. We have a very clear, robust capital plan to do that. But of course, it's going to take time, but we're very clear that we've got the resources absolutely secure now to make sure we can move forward and deliver that. Next slide, please. Now, these are our current CQC ratings. For those people who are less familiar with us, this was part of inspections quite some time ago now in 2018-19. But just important to say that CQC did suspend some of their inspection processes during the COVID pandemic, but they are now starting to enter into inspections. And I'll talk a little bit more about that on the next slide. So previously in the trust had received warning notice. This was again some time ago now, but it's really important to share with you that those have been removed. We have strengthened the leadership and governance, and we talked about that at our last annual meeting, but really important to say we continue to do that, and I think that has been recognised by the CQC. And I'm pleased to say that our phased approach in terms of taking immediate action, quality improvement and embedding is starting to pay dividends, and I'm really pleased to say that we've got that recognition coming through. We have had a recent inspection from CQC as part of their routine processes, and they did inspect 3 of our services, not all services, because they've changed the way in which they do inspect. And we do expect to get some feedback that we can share more publicly in due course when the CQC is available and ready to share that. So we will share that as that becomes available to us too. Next slide, please. Now, one of the areas that had been previously raised by CQC was involvement of patients and carers. And of course, Kathy's touched on this already. This is such a golden thread for us now, and one that is very firmly embedded, placing patients, carers and families at the heart of what we do. We have a very clear framework for involvement. We've got a lot of examples of co-production and collaboration in practice. And I'm really pleased to say not only the People's Council, but the Youth Advisory Board is really making a difference to the standards of care and challenging and confirming with us where we can make a difference for our people and our families and carers too. So some great examples of co-production in practice, and we will continue to strengthen this in the next year going forward too. Next slide, please. Now, you'll notice that I've mentioned staff an awful lot already, and deliberately so. Staff and how they feel, their experience, their engagement with us is a really clear indicator of improving our quality. And we've had a big focus on the cultural work through our Future Our Way, and had a really very clear programme led by our Director of HR, Sarah Willis, who has really instrumentally taken this and developed a series of change champions across the organisation. We had over 90 staff who wanted to step forward and make a difference with us. And of course they have, because they've already helped us to deliver not only our leadership behaviours, our vision, and really challenge us every day to make a difference. So I'm really pleased to say that that is now starting to really embed and really think about the cultural work that we're being recognised for. We've mentioned equality, diversity and inclusion. This is a passion of ours, LPT. We want to make sure that everybody feels a sense of value and belonging. And we know that that needs work, because all organisations need to work on this. But we've taken active steps, and I'm really pleased that we've got some very, very vibrant staff networks helping us to make that difference and to really be active listening voices with us across the organisation. We do have a staff survey in the NHS, and I'm pleased to say that our response rate was an improved one, which means that people wanted to tell us about the experience. And we had improvement in most of the indicators, which really does give us encouragement about the cultural work. But we know we have more to do. But encouragingly, and I think important to share with you, that our Freedom to Speak Up Guardian continues to be very active across the Trust, encouraging staff to raise safety concerns. And I'm pleased to say that in the high-level feedback from CQC, they definitely fed back to me the safety first culture that we're developing here at LPT. Next slide, please. Now, one of the things that we mentioned last year was about our buddy trust arrangements with Northamptonshire Healthcare Foundation Trust, where I am the Joint Chief Executive. And we initially took on targeted support from them to support us following the CQC inspection. But it soon became very clear that there was mutual benefit that both boards recognised in learning together. And I'm pleased to say that beginning of April, we continued our relationship with Northamptonshire and created our group model. So we're no longer in targeted support from Northamptonshire. We're in a very much mutually beneficial relationship about quality improvement together. It's not about merging organisations. It's not about changing the organisational focus, but it is about striving for excellence together. And I'm really pleased to share with you the 8 strategic priorities that we're focusing on initially to say where could we really make a difference and really be excellent and develop across both organisations. Our staff networks already connect and they've gone from strength to strength, but we've got areas of focus that you'll see that range from leadership and organisational development to Together Against Racism, which again signals our commitment to this important piece of equality, diversity and inclusion work. And we want to focus on talent management. We want to make sure that we can create opportunities for people to stay within the NHS, to get development, to not have to move out of our local populations because we're here and ready to develop them. We know this is an area that we could do more on, so we want to do that together. And of course, quality improvement is something that we've done together already, and we will continue to do so in the group model. So look out for more information on that, but a very important part of our movement towards stepping up to great. Next slide, please. Now, many of you will be aware that integrated care systems across the NHS and the care sector are now the national policy direction of travel. And in Leicestershire, Leicester and Rutland, we are no different. We anticipate and expect to be an integrated care system in due course. And we are playing a very active part in that. And I think we can demonstrate and evidence a really strong commitment to partnership working. And that is recognised by our partners who really have seen the difference in the work we've been doing over this year. We're very much active members of the Partnership Board and the NHS Board. And of course, we have lots of participation in all of the groups that exist across that integrated care system. But I really feel that it's important to share with you a couple of the areas where we've taken real key leadership in terms of trying to support more of the focus on population health and outcomes together. And I want to mention our work in learning disabilities because we know this is a really important area for our population and in reducing health inequalities. And we've now taken the lead in the integrated care system to support this work and made significant improvements. And I'm really pleased that our commissioning colleagues, our provider colleagues, our care colleagues are all now working very carefully and collectively on improving outcomes for people with a learning disability. And I think that really is a very good example of system working that we have been instrumental in. We've also been very, very pivotal, as I've mentioned before, in terms of supporting through COVID and in particular the vaccination programmes across LLR. We've all had to work differently and we have. And I'm really pleased to say that again, through our Director of HR, we have led the Workforce Bureau for the system to make sure that we can support the workforce requirements for vaccinations. It's not been easy, it's challenging, but nevertheless, we've stepped up and been a strong partner to support the system working that's been required at this time and support the integrated connections across our system. We've also taken a very strong lead, as you would expect, around the mental health. And I'm pleased to say that whilst we have our consultation on Step Up to Great Mental Health, we've played a really important role in developing collaborative working making sure that our system can support us in new models of care and that our public can recognise the benefits of working differently with the voluntary and third sector, which again is going from strength to strength. Next slide, please. And partnership working doesn't stop, and I just wanted to share with you another example of partnership working, which we are absolutely developing and improving upon as we go through this year and will continue to in the next period too. So within our mental health services, we are working now in alliance across the East Midlands. So we're working with other partners, other NHS trusts in mental health, and in St Andrews, one of the independent care sector providers, to really think about how we can work differently, share collaborative ways of working, think about learning together. We really took a very open approach to improvement. And I'm pleased to say that's not only led to improvements in developments that I've described, but also to being able to become lead providers for regional services. And LPT is now a regional provider, a lead provider for adult eating disorders. And that's a really important step because it wasn't as simple as just becoming one. There's clearly lots of processes to go through to demonstrate our robust governance, our robust quality and our robust ways of working with our partners. And we anticipate and expect that this partnership will give us a real opportunity to improve outcomes and population health for our local population going forward. So in essence, partnerships will always be a golden thread within our population and our work, and it will continue to go from strength to strength. And just a final note that I want to say to all of you in the community, and I hope that you hear this very much and that you really do listen to the fact that I want to say an enormous thank you to you, because Kathy's already mentioned the support we've had through our charities, but I think we've had tremendous support from our communities at large. Our Step Up to Great mental health consultation couldn't have been more actively engaged upon, and I've got so many examples of our communities making a difference with us throughout this period. So thank you very much. We feel that support. Our staff have been very challenged this year with the COVID unprecedented pandemic, but I know they've felt you and they've felt the support. So from me, on behalf of them, I want to say thank you to every one of you for making that difference and supporting us. And we look forward to receiving your support in the next year too. Thank you.
Hello, good afternoon, everybody. Thank you very much. My name is Anne, and I'm very proud to say that I'm the Director of Nursing, Allied Health Professionals and Quality of the Trust. So next slide, please. Thank you. So what is our quality account, or what is a quality account? Every NHS Trust publishes a quality account to describe quality and safety performance and quality improvements across the services. It offers a description of any ongoing research and audits, and also notes our Care Quality Commission ratings, detailing learning and how we are making improvements to better our patient care. It also describes our future priorities and ambitions for what we hope to achieve. Next slide, please. In the last year, our quality priority to improve patient experience and involvement has made some significant improvements, which both Kathy and Angela have already mentioned. We launched our new patient experience and involvement framework, and we've developed our People's Council and continued the excellent work of our Youth Advisory Board. And we have increased the membership to our Patient Carer and Involvement Group. We've also made some significant improvements in making care plans more personal through our monthly recovery and collaborative care planning cafes with patients and carers, using a concept framework for personal recovery in mental health. Our second priority last year, to reduce avoidable harm, has focused on ensuring that comprehensive risk assessments and risk management plans have been developed. And our third priority last year was to improve how people access our services, and we have introduced clearer and more robust systems and processes for reviewing all of our service users who are waiting, improving our waiting times, and making sure information about our services is reviewed directly by our board. Next slide, please. Further improvements we made last year have included the launch of our research envoy scheme, which is in the top right picture in this slide, which provides an opportunity for our staff to raise the visibility of research within services, to focus on understanding how clinical research can support and improve patient care. As Angela has already mentioned, a number of our wards have received external accreditation status through the Royal College of Psychiatrists to ensure we have high standards of care. And we've made significant improvements to youth-proof our services with our excellent Youth Advisory Board, which is in the top left picture. And these guys support the improvements and development of services to ensure our young people have a voice. We've also built on our trust-wide quality improvement framework, which we call We Improve Q, which reflects our collective ambition to become a learning organisation and for all staff to feel empowered to make improvements. This is already starting to enable our staff to make local improvements. And our Time to Shine work is another key focus the Trust is highlighting the importance of quality and safety and our environments and clinical practice to enable our staff to deliver better patient care and help our staff to feel proud to work at LPT. Next slide, please. So these are our top 5 priorities for the next year, and we're going to work on reducing ligature risks, improving hand hygiene, reducing the length of stay in our hospitals, improving how we manage complaints, and improving our service user feedback through our friends and family test. So whilst COVID has impacted on some aspects of within this, work is underway within each of these priorities already, and early indicators show improvements in hand hygiene and our response to complaints. The new friends and family test will be live, and we will encourage all of our service users and carers for feedback to improve our services through this way. We have also focused on improvement journey in place to review all of our ligature risks and systems and processes to keep our service users safe from ligature risks and ensure consistency across the Trust. Next slide, please. So Angela's already mentioned our fabulous People's Council, who form part of a key part of our patient involvement delivery plan. The aim of the council is to act as an advisory board for the Trust, and membership includes individuals who have lived experience of receiving healthcare services from within our services, and includes our patient and carer leaders and members from voluntary and community sector organisations and groups who work with different communities across Leicester, Leicestershire and Rutland. The council is currently chaired by Mark Farmer from Health Watch, who is one of our lay board members, and the council's key principles are to act as the voice of patients and carers and ensuring these views and aspirations are taken into account, and to work with the Trust to support the strategic direction for our Step Up to Great strategy and our patient involvement work. The council will also help to agree priorities in response to feedback that we receive to enable and influence improvements that deliver an improved patient experience and promote the values of public engagement as a champion for the council. They also actively participate in patient engagement activities and through alignment with clinical areas contribute to improvements in the patient and carer experience, ensuring that the patient's views is heard. And I would also like to extend my thanks to the council members very much for their support and commitment. Thank you for listening. I'm now handing over to Sharon, I think. Sharon, our Director of Finance.
Yeah, hi everybody. I'm Sharon Murphy. I'm the Acting Director of Finance for the Trust. So we've heard throughout today around the impact of COVID on the Trust, and this is also extended into the financial arrangements. So the usual contracting and payment mechanisms that we work to were paused nationally last March in response to COVID. So for the first half of the financial year, we received a block payment And then we had additional funding which topped us up for any COVID-related costs to ensure that we could still break even. For the second half of the year, a similar approach was undertaken, but we were set a financial envelope to work to, and this is more similar to the way that we usually work, as we operate under a block contract normally. Financial plans were submitted for each half of the year, which I'm delighted to be able to say that we achieved. The Trust also ensured good financial arrangements and management and appropriate controls were in place throughout. Next slide, please. So it's really pleasing to say that under the exceptional circumstances that the whole Trust was under, we were still able to deliver all of our statutory duties around capital and cash, and also ensured that we delivered a small income and expenditure surplus. Next slide, please. When we talk about break even, what it basically means is that the income that we receive roughly balances out with what we spend. And that is what we were able to achieve last year. As I say, we achieved a small £9,000 surplus, which in the context of our turnover is roughly break even. Next slide, please. Also, as part of our planning processes, our regulator, NHS Improvement, set us control total targets, and that tells us what we need to achieve as part of our financial plan. For 2021, we were asked to deliver a break-even on income and expenditure, and as I've said in previous slides, that £9,000 surplus that we delivered meant that we also delivered our income and expenditure break-even target. Next slide, please. So to go into a little bit more detail around our numbers, last year we received £326 million worth of income. And consistent with previous years, the majority of our income, so about 74%, was received from clinical commissioning groups, who are our main commissioners of services. The only unusual item on our income last year is shown there as our top-up funding. And as I said before, this relates to the general top-up that we received in the first 6 months of last year that helped us to break even, and also includes some income that we received around COVID-related costs. Next slide, please. So as I say, we broke even on our income and expenditure, so that means we spent roughly £326 million last year. And this slide shows the broad headings of where the money was spent. Again, as consistent with previous years, the greatest proportion of our spending is on our staff, with £243 million, and that's roughly 75% was spent on staffing. Some of the COVID-related staffing costs that are shown in that £11 million number on the slide relate to extra services, staff that were brought in to support services, including bank staff, overtime payments to our existing staff, and also some staffing costs related to the COVID vaccination programme, which we've mentioned. In terms of buildings and equipment supplies, equipment costs, they are our running costs, so cover things like rent, rates and utilities. And the £1 million that we've highlighted there that was related to COVID-19 was to fund things like additional cleaning and also some costs that we incurred in relation to ensuring that our infection prevention and control measures were appropriate in response to COVID. Our supplies costs, so things like drugs and bandages and those types of supplies, also incurred some extra costs related to COVID, and that mainly relates to the PPE that was supplied to us direct from the Department of Health into the Trust. Next slide, please. So capital expenditure shows our expenditure on long-term assets, and within that, last year we spent approximately £8 million on building and environmental improvements, and that includes the completion of the Beacon unit, which has been mentioned in other presentations today, and also the first phase of our dormitory elimination programme on our mental health wards. We were also investing in our single electronic patient record system. And again, in technology, we were also able to invest in kit that supported agile and new ways of working as staff across all services responded to COVID-19. Next slide, please. So as we look forward to 21-22, the first half of this year, we had similar arrangements to last year in terms of we had a block arrangement, but this year we also had a small efficiency expectation, which brings us back to our more similar to our normal way of working in terms of what we deliver within the financial position. We're expecting guidance shortly for the second half of the financial year, following which we will submit our financial plans and continue to focus on delivery of our medium-term financial strategy together with our LLR integrated care system partners. Thank you.
Thank you to Angela and Sharon for their excellent presentations. I hope you found that informative. Now it's time for you to post your question in the chat. We'll shortly be opening that. If you can keep your questions brief, then we'll be able to answer as many as possible today. Please don't put any personal information in there. If you do want your question to be anonymous, then you can tick a box to do that. So as I say, we'll deal with as much as we can today before 5:30, but if we don't get to your question, please do email us at the email address that you can see on screen now, and we'll get back to you with a personal response. So I have received 6 questions in advance of the meeting. So while you're putting your questions into the chat, I'm going to start with those and then we'll come on to the chat questions. So first of all, a question relating to what are our plans to roll out the drop-in centres across both the city and county? So I'm going to feed that through Anne, our Director of Nursing. So Anne, could you answer that one for us, please?
Yeah, so I'm assuming this is vaccination related, Kathy. So what I would say is that we have plans in place. We will have a mixture of booked and walk-in appointments on offer for choice and convenience. And the drop-ins tend to be in demand and generally planned with about 2 to 3 weeks notice. We're also working hard with public health colleagues and sort of colleagues across Leicestershire and Rutland in health, looking at the areas of the lowest uptake so that we have plans to develop dedicated services for hard to access groups. I hope that answers the question.
Thank you. Our next question is, are there any opportunities for career progression for BAME staff? And what efforts are being made to ensure that staff are aware of these opportunities, as they don't always filter down to grassroots levels? So I'm going to ask Sarah, our Director of HR, to answer that one. Over to you, Sarah.
Okay, thank you, Kathy, and thank you for this question. So ensuring our BAME staff have access to career development opportunities is one of our strategic priorities. It's outlined in our Step Up to Great strategy, it's outlined in our people plan, and specifically it's set out in our Workforce Race Equality Standard Action Plan. In relation to the actions that we're taking to achieve development of our BAME staff to senior positions, we've set ourselves a target in alignment with the Model Employer National Target to increase BAME staff representation in senior positions by 40 staff over the next 5 years. In terms of how we're going to do that and reach our frontline services, I hope colleagues will be familiar that our appraisal process that everybody within the organisation goes through annually has a section on career aspirations for our staff, and we will be specifically using this to target our BAME staff who have indicated a desire to develop and progress. Linked to this, over the next year, in line with our people plan objectives, we plan to roll out talent management across the trust, and we will have a specific additional focus on our BAME staff in terms of talent management and career progression. We're also, within our Workforce Race Equality Standard Action Plan, have actions to provide bespoke career development for our BAME staff and all of our staff through our what we call our We Nurture programme, and we provide more access to interview skills training. Our latest figures indicate over the last year we've seen an additional increase of 10 BAME staff appointed to senior management positions across the trust. So that's positions above 8A, which is really, really good, and I think indicates that we are well on our way with our trajectory. So I hope that answers the question. Thank you very much.
Thanks, Sarah. We just need to make sure, I mean, the question was about filtering down to grassroots level staff. We just need to make sure that these opportunities are publicised widely so that people can engage with them. And of course, if everybody has an appraisal, that's the way to access it on a one-to-one basis. All right, thanks, Sarah. So next question. What is the board doing to advance carbon net zero? And I'm going to ask our Chief Financial Officer, Richard, to answer that, please.
Yeah, thanks, Kathy, and yeah, good afternoon, everyone. My name is Richard Wheeler, Chief Finance Officer across the group. So yeah, climate change, as we know, poses a major threat to our health and to our planet. So we've set out some details within our annual report. We have a corporate social responsibility document which sets out our requirements under the Climate Change Act, and we're also developing a 5-year greener plan which will work towards the carbon net zero ambitions. Some examples of our more recent work: we have submitted an expression of interest under the government's new hospital programme that would support more sustainable infrastructure alongside the net carbon zero agenda. Our new Beacon unit, which was referenced earlier, that's a BREEAM accredited development that makes it more sustainable, supports and enhances the well-being of staff and patients who occupy that unit. And that also includes solar panels on that unit, as that we have across a number of our sites. We're also including requirements on our contractors to support the green agenda, including energy efficiency and waste management protocols. And we're looking to use more local contractors. And then finally, Kathy, we're supporting under our RRR Reset Recovery Programme flexibility for staff, again, to minimise travel and make more efficient use of our buildings where we can. Thank you.
Thanks very much, Richard. So the next question was, could we please explain why LPT changed providers for our interpreting services for the deaf to Word 360? It's made it impossible to book interpreters. And please, could you advise on this?
Yeah, thank you, Kathy. It's a really good question. So we needed to change our contract with our original provider due to contractual regulations. And when COVID hit last year, well, we needed to shift from face-to-face interpreting to a virtual platform. We have used the same provider who we've used for the last 15 years to provide our British Sign Language interpretation service. We've also met with the Leicester Deaf Forum on a number of occasions to hear their concerns and try to address these, which we will continue to do so. However, I'm also acutely aware that there have been some challenges for patients linking with GP practices, and we're working closely with our clinical commissioning colleagues who are responsible for the GP contracts to address these concerns in more detail. And we're also setting up joint meetings with our CCG, our clinical commissioning colleagues, and the Deaf Forum to discuss these concerns further. So I hope that helps in some way to respond.
Thanks, Anne. Our next question is, what are your next steps for the Step Up to Great mental health review? So I'm going to ask our Chief Executive, Angela, to answer that one for us. Sorry, Angela. That's it. I can't hear you. That's it. Perfect.
Can you hear me now? Yes. OK, so thanks, Kathy. And I wouldn't want to miss the moment again to say thank you to everybody who did contribute, because we had, as I said before, such a lot of engagement and people came and participated and were really willing to share their story, which is really, really incredible. So thank you for those of you who participated. But just to say that we will be going back to the public, but about December time. So as you'd expect, we're now progressing all of the findings. There's such a lot of material in there. We've got the next steps in our consultation website, so I'm sure we can put that into the chat for people if people haven't been able to see that already and don't know where that is. Please, I'm sure our comms can put that in. There will be a final consultation of the findings published, so important for people to look out for that. And that will be discussed by the clinical commissioning groups, and they will make a decision business case which will outline the recommendations of the proposals based on your feedback. So again, what we'll make sure is that that meeting is widely circulated so people can understand what's happening and when it's happening. And we will make sure that we obviously publish the findings as well. And then, of course, once we know the decisions that are made by our clinical commissioning groups, because they ultimately do need to make those decisions, we'll then do some further work to co-produce with our families, service users, patients and public in terms of the improvements and implementation. Thank you.
Thanks, Angela. So I've got one more question that came in advance, but just before I do that, just a reminder, you can pop questions into the chat box and we will pick those up and answer those today. We've got some coming in, and but if you'd rather email us, you can do that as well. So just to clarify that. Okay, so the final question that came in advance, are the board aware that within community health services, community nursing teams, there is a complete mismatch of responsibility and role in two key roles? namely the complex care nurses who may or may not hold specialist qualifications, to nurses in the community and district nurses who, by the very definition of the title, must hold a specialist qualification in community nursing. They then go on to provide quite a bit of detail about the disparity in grades and qualifications, and finally ask, can the board give assurance that this will be looked at and steps put in place, including proper career progression for SPQ qualified district nurses? So I'm just going to refer that one to Anne, our Director of Nursing.
Thank you, Kathy. It's a really interesting question, actually, and a really helpful one. So I would like some time to understand the points within that question, because it was a very detailed question, and I'm absolutely aware now, and would like some time to understand that and come back to whoever answered the question, but also from a trust perspective to understand that better. So that would be my commitment. Okay, so definitely we will come back to you. Thank you. So I'm moving on now to the questions that are in the live chat. Thank you for the people who've put those in. So firstly, this isn't a question but a comment, and I think it's important to read this out. As an employee, I have felt really supported during the COVID pandemic. It has been an anxious time for all of us, but the support and caring approach from the Trust has made it so much easier for me and my family. Well, thank you. It's really good to hear that. I'm sure we are doing our absolute best to support you and your family's well-being. So really good to hear that. Thank you. So next we have a question. What opportunities are there for development for non-qualified staff? It can feel very hard to progress from Band 3. So I'm going to ask Sarah Willis, our Director of HR, to pick that one up, please.
Thank you, Kathy, and thank you very much for this question. I think this refers back to my response to the other question that we had. Actually, this is all around talent management and supporting and developing our workforce. So within our people plan, we've got many actions and objectives, but really fundamentally growing our own, developing our workforce, retaining our workforce, and supporting our workforce to progress through understanding where our talent is, where our staff aspirations are. It's all really, they're all our priorities. So this is where the opportunities will come. So I refer back to my response before in terms of all of our workforce should have an appraisal. They do have an appraisal, and within that there is an opportunity to discuss with your line manager your aspirations in terms of career progression, whether or not you wish to be put forward onto our We Nurture programme. That's open to all professions, all grades across the organisation. So I would encourage you to have that conversation with your line manager, or alternatively, and as well, come through the OD team and ask for some updates on what support's available. There are lots of learning and development support that's available for our workforce. Thank you.
Thanks, Sarah. And I guess just while we're waiting for some more questions to pop up into the chat, you will have heard the national announcements last night, really, about COVID booster jabs and also what's happening with 12 to 15-year-old jabs. And of course, we will be making plans for that locally. So I just wanted to ask Anne to pop on and just say a few words about that, because I'm sure that's something that would be interesting for you. And do you mind?
Yeah, yes, I mean, I think it's probably fair to say that at the moment, we're waiting on the announcements locally, and we do have plans in place, and we're ready to rock and roll, basically. I think we've got an excellent school immunisation programme running already, and we're very proud of that and the teams that run that for us. So I think we're good to go whenever we're able to, is probably the fairest thing to say.
Yeah, thanks, Anne. I'm sure preparation have been underway for quite a while, haven't they? So we've got another question in the chat. What are you most encouraged by in the latest annual staff survey results? Thanks for your question, Carolyn. So I'm going to ask Angela to come on and say a few words about that.
Thanks, Kathy, and thanks, Carolyn, for the question. So I think, as I was saying in the presentation, it was encouraging generally because we clearly had a good response rate, but I was really encouraged by the areas where we had above national average responses. So the response rate overall in terms of 52% was good, very encouraging. But the fact that we were above average in terms of safe environment, bullying and harassment is really important, because we know this is not typical across the NHS. So I think that was really, whilst I was pleased with all of it in terms of improvement, that one in particular.
Yeah. So, thanks, Angela. I would agree, absolutely. I think the staff survey reflected the cultural improvements that we were making in the trust, didn't it? And that certainly reflected all of the work that our change champions had been doing with us. So thank you to them for those. Okay, we've got another question. I was involved in an interview with Rob Mellion and Georgina Kelly that involves people within a doctor's surgery and a mental health practitioner. I'm not sure what that question's about, actually. If you can perhaps pop in a bit more detail, that would be helpful. I've tried to access the We Nurture programme without any positive outcomes. So I'm moving on to a different question just while we get some more information. Appraisals often feel like a tick list. Appraisers don't often know how to help the person being appraised. So can we give some reassurance? Perhaps, is there any training for line managers there, Sarah, that could help with that particularly, and how people can access the programmes?
Yeah, yes. So we've recently refreshed and renewed our training management system, our learning management system, ULearn. So colleagues will see that there is some online training on there for appraisers and appraisees, taking you through all of those elements. So I would encourage you to access those for support initially, and then if you're still struggling, again, please come through to the OD team and ask for some support, and we're there to help you. Great,
thanks, Sarah. So moving down, it's great to hear all the progress this last year despite all the challenges. Absolutely, absolutely. It's been phenomenal, hasn't it? How far we have come in that time. Could I ask, what are the top priorities for LPT for the next 6 to 12 months? So Angela, do you want to take that one, please? Just check that your microphone's off.
Is it working?
Yeah, that's it. Lovely. Yeah. Thank you.
So a myriad of things through our Step Up to Great strategy, because that allows us to focus on a number of priorities around high quality care. So Step Up to Great will be continued priority for us overall. Our partnership working, which I've mentioned, will continue to be a strong thread for us, because without that we can't make the difference, you know, and Step Up to Great mental health will rely upon it. Our integrated care system work will depend upon it. And improving outcomes will depend on that too. So that's really important. And I think the other thing that we say is, in terms of some of our estate work, we want to eradicate our dormitories. We're really clear that we've got those plans in place, but we want to make sure that we can improve that for our population as well. So those are some of the priorities that we would want to share today.
Yeah, and I think I would add my personal one for championing staff health and wellbeing. You know, it's really important our staff feel well when they're at work and feel supported. So we will continue to do that. Then moving down, next question is, instead of recruiting from abroad, why are staff below Band 4 not given the opportunity first? So Sarah, over to you, please.
Thank you. I think the response to this has to be that we want to grow our own and are working through those actions through development programmes, encouraging colleagues, staff to undertake nurse degree programmes, open university programmes. So we want to grow our own workforce. At the same time, we have some significant workforce challenges across our nursing portfolio. So we have taken a decision to recruit from overseas and have been quite successful in that. I think in answer to the question is that we want to do it all. So there are opportunities for overseas and for our internal staff as well. It takes time to grow our own. So right now we have an immediate requirement to meet some of our demand, our supply issues in terms of registered nurses. That's why we've gone down the overseas recruitment route. I can see Anne's nodding her head. I don't know if she wants to add something to that.
No, I think you articulated it really well, Sarah. Yes, we absolutely we need to do it all. and it isn't instead of, it's as well as, so it's a really good question. But I mean, I would absolutely support what you've just said, Sarah, and you know, would want to grow our own, give opportunities to all of our staff, whatever band they are, and ensure that we also welcome our international nurse recruits and allied health professional and medical support as well. So I think it's a question of not doing one or the other, but trying to do both and do it well.
Thank you both. So our next question is, as a member of the service user group, I would like to say how fantastic this approach is and applaud the work undertaken by Hayley and Sandy. I would absolutely agree with that. Thank you, ladies. The training offered to service users is great. However, can it be confirmed whether LPT staff are trained as to how to get the best out of service users when they sit alongside projects or working groups? So I'm going to ask Anne to talk to that one, please.
That's a really good question, actually. It's an excellent question, whoever's asked that one. And the simple answer is yes, through making every contact count training. But actually, I think if it's okay, I'm actually going to pick this point up and feed this into our delivery plan, because I think it's a really good query, just to make sure that we're checking ourselves. And I will ask our People's Council to keep a check on that we're actually doing that well. So thank you for whoever asked that question. Yeah, no, it's a great question, isn't it? We do need to keep reviewing how we're doing with that, don't we? Very important. So our next question is, what do you feel are the greatest opportunities and challenges within the integrated care system? So I'm going to ask David Williams, our Director of Strategy, to answer that one, and then perhaps he could bring another director in too. Over to you, David.
Thank you, that's useful. I think the big thing about integrated care and bringing people together and working stuff through is about creating the space so that we can all work together to solve the problems. And I think that's our challenge. We know what's wrong with the system. We've had quite a few years of a different way of working, but we've now got this really good opportunity for coming together. So the focus on integrated care is going to give us a chance to bring local authorities, the voluntary and community sector, and ourselves together with partners from across the NHS. So that would include general practice, so doctors, pharmacists, Optom. And I think bringing all that together would mean that actually we should be able to get to a place where people only get assessed once, information shared and developed and worked through. So doing all that is a change in the way we're working. And I think if I was to summarise what the biggest challenge is, I'd say it's about just creating the space where we'll all do that and take us forward and work through different opportunities.
Okay. What about Sharon? Would you like to comment from a system financial perspective? I know you've been working very closely with the other directors of finance, haven't you?
Yeah, I think people will be aware of the challenges that we have across the NLR system in terms of the finances, and some of that is structural, so it's been there for a long time. So it's really good to actually be able to work together with partners on an honest basis and sort of look for solutions together that are sustainable, so that we don't just sort of try and fix each year's problems as they arise within each organisation, but actually work with partners to deliver for our population, not just for the current year, but into future years as well, make sure we have a sustainable future.
Yeah, absolutely. So moving down to the next question, is there an agreed timeframe for LPT to bring estates and facilities in-house, or continuation of provision or an alternative provider? So I'm going to ask Richard Wheeler to pick up that one, please, our Chief Financial Officer.
Thanks, Kathy. Yes, so the board has approved bringing the estates and facilities services back in-house. We're in discussion around timescales for that. It's quite a complicated transformation programme, and we need to engage appropriately with staff and with providers and contractors that we're working with. So we're looking to do that over a 12-month period. I mean, clearly, if there is opportunity for some elements of that to move at a quicker pace, we will work through that, but it is quite a complicated and an involved process, so it's around a 12-month period that we are planning to work through.
Okay, thank you, Richard. So I'm not seeing any further questions in the chat at the current time. Oh, actually, one's just popped in. Here we go. Sharon mentioned that further guidance for the second half of the financial year has not yet been received. Considering the second part of the financial year starts in just over 2 weeks' time, 1st of October, how are the trusts supposed to be able to formulate robust plans in advance of this? Well, feel reassured. I know that Sharon has the answer to this. So Sharon, can you come on and answer that for us, please?
Yes, of course. Although we haven't got the detailed guidance yet, I think it's due on Thursday, 16th, so hopefully we'll see it quite shortly. But in the absence of having that detailed guidance, we have still been working on our plans. We know broadly what our assumptions will be as we go into the second half of the year, around what our costs will be particularly, and we've had early indications around what some of our income assumptions are. So although we haven't seen the fine detail of the final guidance, we know broadly what it is that we're aiming at, and so we have plans in place ready to just fine tune when we do get that final piece of guidance later this week.
Yeah, great. That's good to know. No further questions at the moment. Just give it a minute or two. Just want to make sure we're able to pick up any questions that anybody's got. As you can tell, our environment is a rapidly changing one. Lots of announcements coming from central government, and we're doing our best to respond to those quickly. So I'm not seeing any more questions, and there are none waiting to come in. So I just want to double check. Yeah, nothing else coming in. So I think we've been able to answer all the questions from the attendees today. I can see in the top of my screen we've got 56 attendees. That's brilliant. It's been great to share our news with you and great to share our performance over the last year. So if we are finished with no further questions, then I'd just like to say thank you for attending. It's been our absolute pleasure to host you, and we look forward to seeing you again next year. All the very best. Thank you. You can just close the meeting there.